comes to symptoms of scleroderma, it really depends on what subtype the patient has. But there are a few symptoms that happen frequently in both. The first is called sclerosis. This is a fancy word for skin thickening. And if you can imagine, if the skin gets thick over, let's say, the joints of the finger, then the patient can't really bend that finger anymore. In the limited scleroderma, this skin thickness happens in the fingers, which is called sclerodactyly, and it happens a lot around the mouth so that they can't open their mouth fully. In diffuse scleroderma, this can happen on any part of the body, including the arms and the legs, and covers a larger area. The second thing that is very common to both types is called Raynaud's. And Raynaud's is when the blood vessel going to the finger or the toes actually becomes abnormally small or more narrow at even a small drop of temperature. So normally when our bodies are outside in the freezing cold, it is normal for the blood to the finger and the toes to be clamped down or to be shut down so that more warm blood comes to the middle of the body where the brain and the heart and the lungs are to kind of keep the important things alive. However, in Raynaud's, this phenomena happens even with a slight temperature change. So even when the patient wraps their fingers around a cold drink, or they reach into the fridge or the freezer, etc. Now, it is important to note that all Raynaud's is not due to scleroderma. In fact, for every 1,000 people on Earth, 4 people have Raynaud's. 3 people, that's how they are made, but 1 person has it due to an autoimmune disease, and not just scleroderma, but other types as well. The third thing that is very common in both these diseases is attacking of the gut or the GI system in these patients. So if the esophagus is affected and these patients can't swallow as well, or they're getting a lot of heartburn, it can be called esophageal dysmotility. They can also get small blood vessels in the lining of the stomach that will constantly leak a little bit of blood into the stomach, and so they can become more anemic over time. And some of these patients can have a hard time moving their bowels, so certain areas bacteria can overgrow in the bowel and cause a lot of bloating.